let's just talk a moment about what is it. So I am a BioT trained physician provider, and Monica can show you how to spell that if you want to go look this up. But the difference is that they are bioidentical pellets. And so what we have to recognize is the benefit of this type of therapy versus the patches, versus the creams, versus the sticks, the testosterone injections, is that it is a steady state that the body is able to reach with this, because the absorption is based on cardiac output. And so as long as your heart is beating, the blood travels past the insertion and it gets taken into your blood supply. There's no give yourself a shot, you get high on the mountain and then you crash. So there's no steady state. In addition to, really, you want to give yourself a shot. Some men give themselves shots weekly. That's 52 shots a year. That's a lot. And these are deep intramuscular shots. So, but the advantage here is that it is a steady state. The advantage is that dosing is based on your labs. The advantage here is they last anywhere from 3 to 4 months for a woman, 5 to 6 months for a man, just depending on how active you are, what other issues you have going on. And so, and also cost, this does not cost $7,000 a year. I mean, my goodness. And like you said, what were you getting for that? And so, it's the value, and we just want to feel better. Mm-hmm. And we say around here all the time, if you're sick and tired of feeling sick and tired, then do something. Do something. Don't expect someone to read your mind. We are not mind readers. So do something. Do something for yourself, for once, right? And come and see if this could be right for you.
The question of, are men and women both candidates for hormone replacement therapy?
Hi Josh, that is an excellent question, and my answer to you is yes, absolutely. So if you are familiar with the symptoms of hormone needs, they are very, very all-encompassing. Let's talk about low energy. Let's talk about lack of sleep. Let's talk about more sleep actually than necessary, mood disturbances, okay, the gamut. And those apply to both men and women. It's just that which hormone can help the man or the woman is the difference. So yes, that is a resounding, it is for both men and women. Let's talk about, because I know, and me and Crystal know, and Debbie, about the women. So let's get your perspective. The things that some men might not really understand is linked to low testosterone, for instance.
Mm-hmm. Well, there's quite a few of them on there. Fatigue a lot.
Fatigue a lot. Mm-hmm.
Yes.
Absolutely. Mm-hmm.
And
what about the joint pain?
I already got that.
Yep. Joint pain could be related to hormone instability.
Mm-hmm. And there's quite a few of them on there.
Quite a few. Irritability, fatigue, feelings of decline in your general well-being, depressed mood, exhausted, lacking vitality, decreased muscle strength, feeling burnt out, belly fat, weight gain, inability to lose weight, hair loss, decreased in the growth of your beard, decreased ability to perform. And all of these are not okay. Whoever said that our latter years shouldn't be better than our former years? Who doesn't want to feel like you're 20 again, right? So I didn't say go back and be 20 and relive that. No, I don't want to do that either. But who doesn't want to feel younger and feel vibrant? And whoever started lying to us and telling us we shouldn't, right? It's an utter nonsense. You have a purpose in life, and you must be in the game of life with your brain working, energy levels there, so you can go out and achieve that purpose.
And Tina from Festus, how do I know if hormone therapy is right for me?
Perfect. Perfect, Tina. So we've spoken a lot about the male side for Josh specifically. So let's talk about the female side. Hi, Crystal. You ready?
Yeah.
So what on the female symptom checklist do you think that most women would say, you know what, I probably have that, and really that could be related to my hormone levels?
Well, the fatigue and the weight gain is probably on the top of the list, and the swelling all over the body. Never thought of it that way, and joint pain, of course.
Yeah.
And then the other things.
Hot flashes.
Hot flashes. Yep. Men can have those too.
I don't think I asked you. and of course the stuff that goes on in your brain, like the memory loss and the confusion, like what was I doing every 5 minutes?
Yep, absolutely. So I would echo that, you know, fatigue, memory loss, brain fog, clarity. Let's look at that word called tension. Let's talk about headaches. Let's talk about bloating. Let's talk about cyclical headaches, okay? And so how do you know if it's right for you? That's a great question. We will start with a questionnaire similar to what we're discussing here. And then you will have a conversation with the patient care coordinator, who is actually Debbie. And we will determine, is this right for you? If it is possibly right for you, then there's certain labs we'll have to get, and then more conversations about what we will be doing. So these are top concerns of women. You know, we talk about the middle-aged middle, right? The middle-aged middle could be related to imbalances of hormones, decreased energy, lack of vitality again. And we as women, we are so busy and we carry a lot on us for the family, right? And so we want to be able to have extra energy at the end of that day to then give to the rest of our family when dad comes home or what have you, right? And so just understand that the imbalances of hormones in men and women definitely put up different symptoms, and it's okay to have those symptoms, and it's okay to discuss, and it's definitely okay to get help for them. And just real quickly, you know, we're focused on right here, we're focused on sex hormones, estrogen, testosterone, but understand there's so many hormones in the body. The hormones are signals created from the brain and other organs that tell the body what to do, metabolism. So we're talking about insulin, we're talking about thyroid hormone, we're talking about so many other hormones that some of them are so long, can't spell them or say them. But when we talk about hormone replacement here at 360 Living, what we're talking about is bioidentical hormone replacement therapy. And that is a huge difference versus traditional hormone therapy, which is not bioidentical, and it is it's actually just drugs. And so when we talk about people who have tried hormone therapy, most often we are talking about the drug replacements. And when you give your body something bioidentical, something identical to its own hormones, ours are plant-based, then your body will react differently. I know that there are stories out there of people who could not tolerate the other options. And so this is a definite option for those people.
Question is from Anna from Cape. What are the benefits of hormone replacement therapy?
Right, that's a good question, Anna. So the benefits of hormone replacement therapy are the opposite of those. So increased mental awareness, that would be decreased brain fog, improved weight loss. Yeah, weight loss. It doesn't happen immediately, but it's definitely something that happens eventually. The most things that happen pretty quickly are the energy, honestly, and it comes different for women. Some of the women will feel increased energy in about the first month or so. The men are going to feel increased energy sooner.
Of course.
And so we want to help our ladies and and then the men will come along there with their increased energy too. So it's the opposite. So improved headaches. Okay, hormones have a huge role in headaches. Improved swelling, improved energy, improved mood. Those are the biggest things. But some things that come along with that is improved sleep, right? And so when we sleep, our body is able to regenerate, and our body is able to heal itself during sleep. And that's why restful, regenerative sleep is so very important for overall health. Great questions, all great questions.